Hi everyone, Michelle Jaelin here and welcome back to my channel. If you are new here, then welcome. Thank you so much for tuning in with me. Today I'm going to talk a bit about the COVID-19 pandemic, and I have some tips on how you can stay safe and healthy for you and your family. Now, before I get into the video, please be sure to subscribe to my channel if you want to see more, and be sure to like this video. First off, as a registered dietitian, I've been getting a lot of comments and a lot of from media and a lot of questions saying things like, I'm really worried about staying in isolation for so long because I'm worried about gaining weight during this self-isolation period. Honestly, my response to this is, I'm not really worried about that. I don't think that it's something to be concerned about, especially during a crisis like now. The alternative to gaining a few pounds could be you could end up with the COVID-19 virus and end up in the hospital in a much worse place. So I wouldn't worry about that. I think it's very important for all of us to really be kind to ourselves and to nourish ourselves in our bodies to the best of our abilities. And that can be different for everybody. So for some people that can mean, they eat more whole food, more fruits and vegetables and that sort of thing. For other people, it might mean that they eat comfort food. We just got to worry about taking care of ourselves and our families in the best ways that we can. So my next point is about going out in public. And right now there is a shortage of masks and gloves. And when I say right now, I mean as of today. So today is March 27, 2020. And right now it's really hard to come by them. I was fit for the N95 mask. I've done mask fit before when I was a dietitian and I did hospital rotations. I had to be fit for one. A lot of healthcare workers really need them and there's a shortage of them. So I see a lot of people going out in public and they're wearing, masks and gloves. And if it makes you feel safe, then okay. But my issue with them is something I've noticed is a lot of people don't really wear them properly. Like there's a way that you're supposed to wear it so that actually really covers your nose and your mouth. The other thing I notice is sometimes when you have a mask on, you have a tendency to play with it a little bit and like to move it around. And then when you do that, you actually touch your face more. And that's something we really want to avoid, because when you're touching other surfaces where other viruses have been in contact with them and then you touch your face, that's when you can transfer the virus onto your face and into your mucous membranes, like as in your nose and your eyes or whatnot. But if you are feeling really, paranoid and it makes you feel safe, I don't necessarily think it's necessary, because I don't, when my spouse and I go out, we don't wear masks. You could always take like a bandana and cover yourself like this. That's what you can do, and maybe it'll make you feel more safe. That's not exactly a proper medical mask anyways. This one I took from my dog. So, but you don't really need them. And the other thing is with the gloves is that, so I'm food safe certified trained. So I have my safe food handler, and normally when you're doing like a food demo, then yes, you would want to wear gloves, or you're working with food and you're serving it to people, you do. But the challenge with gloves and some of the gloves that you use is that it gives you sort of a false sense of security. And often when people wear gloves, they actually touch more things. Like they actually touch more surfaces because they feel like they're protected. And that's also why I generally don't really recommend them. The other thing is that when you tend to wear gloves, you also tend to wash your hands less and not as well, because you feel like the glove is protecting you. So generally, I feel like those also are things that should really be saved for people who are like hospital workers, although the gloves that you use for serving food are different than the medical use ones, and maybe people who work in food service. So if you work you're serving food, like a lot of food establishments that serve food are still have to stay in business, and they might need them too to protect themselves and whatnot. So that's where I don't necessarily think that they're the most important thing. And the most important thing is proper hand washing, and you should wash your hands for 40 seconds. And usually a lot of people, they've done tests where they would check the amount of bacteria or whatnot on your hands after washing them, and people would actually miss spots. So you have to make sure you get in between the fingers and around all the fingertips. In safe food handling training, when we'd wash hands, we would do the whole like rubbing the hands like this, underneath, behind each thumb, like that. Do the nails like this and like that, and then all the way around, and maybe even up your wrists a little bit, and that would be for 40 seconds. So really covering all parts of your hands. Like hand washing is the most important thing. Well, the other thing is time. So a lot of people are spending time right now indoors. It's a good time if you feel like it to learn a new skill, if you want to. It's not for everybody, of course, but I found personally, I have home economics things I like to do, which was like what I learned in high school through like sewing and whatnot. So what I've done was I've actually fixed some of my clothing pieces. Like I had a few shirts that I wanted to sew extra buttons on. I had a rip in one of my pair of pants and I fixed that as well. And it made me feel really good to actually have time and to be able to do that, because it was something I put on the back burner and I was putting off for so long. So if you have other things that you want to do, pass the time in terms of learning new skills, again, it's really not mandatory, but it might help. And this even applies to cooking, right? If you want to, work on cooking something you've never cooked before. So grocery shopping. So a lot of people are really paranoid about grocery shopping. Now, obviously we all need groceries. We all need food to survive, of course. The most important thing too is you want to make sure you wash your produce and stuff properly when you get home. If you are feeling really paranoid, like buying the apples that are out there, then buy the bagged apples. Like, it's up to you. But really, I think just washing it properly under running water with a little bit of friction will help it a lot. That's what I already do in my food safe training. Don't generally wash them with soap. I guess you can if you're not going to eat the outer peel. I would just be a little bit worried that some people, maybe they don't rinse it properly, they end up eating some of it, and you don't want that to happen either. Another thing I want to talk about is I've been hearing a lot of people saying that they're not going to buy stuff from China now because they think that they can get COVID. And honestly, that to me is bullshit. I don't think that's true. Right now there's no evidence that says you should stop buying stuff from that part of the world because you can get COVID-19 from the product that is. I mean, you think about it too, our iPhones are, so many things that we use are from China. So I find it really, I honestly gotta say, xenophobic and racist when I see a lot of people going out there and saying, I'm not gonna buy anything from China anymore. It's do you really know? You can't not buy things from China. And I hear that so much. Technically, if you wanna really get down to it, I'm made in Canada, but my roots are Chinese. So people like us, we shouldn't be around either. And it's just another way of being othering and being racist to other communities, especially my community, and it's got to stop. So you can say that, but really I think a lot of people are just not really thinking about it when they're like, oh, I'm not going to buy that from there because I'm afraid I'll get that. There's no evidence, okay? There's no evidence of that. But one thing I've been actually doing in order to help people pass the time and kind of maintain that positive energy, because we can get feel really down if we're constantly looking at the news and the media all the time, is I've been doing some Facebook Lives of fun things. So I did an art activity earlier today and it was a lot of fun. So despite the fact that I am a dietitian, my background is also in art. I did a degree in visual art and I worked as an arts educator in a museum and a private school, and as well as in summer camps for many years. If you want to know more about that, you can actually go and like my Facebook page. It is at Nutrition Artist RD. If you're interested in seeing more cooking stuff too, let me know. I'm being honest, I actually stalled a little bit on my content creation, and this is especially on my TikTok. And my reason being is because I got some really rude comments and really racist comments saying that I have coronavirus, which is really stupid just because I'm Asian. It's really important to not assign blame to certain communities, because that's not how we're going to fix this thing. The way we fix it is if we all support each other and try and help each other get through this challenging time. And I know I have so much faith in humankind that we're going to get through this, even though it's a tough time right now. Really bring you down all the negative media out there. So I would say limit how much you actually spend on there, because it can really just bring your mood down. And I know because I have been there. So I've had to limit my time too. I hope you found all of these tips helpful. If there's anything you want to see on my channel, leave me a comment. Be sure to subscribe as well, because it really helps me to make more. Follow me on Instagram and Twitter at Nutrition Artist. If you want to like me on Facebook, I'm at Nutrition Artist RD. Thank you so much for tuning in, and I'll talk to you soon.